Hi everyone, it's Susie again, sharing teeth, health of teeth, or teeth and health. Whichever you look at it, dental decay, that would be good, and gum disease. And put it this way, I have both of them. Probably 50, 60 years ago. I remember when I was a young kid. I mean, when I was in Hong Kong, this is before 12 years old, probably 7, 8 years old, I always have toothache. It was so bad. I'm not kidding with you. I would be crying. And my mom would get some of these Chinese herb and just stick it into the hole, you know, the painful tooth. Of course, you know, when we were young in Hong Kong, honestly, I don't think we have enough money to go see a dentist. It was only when I went to America, 12 years old, then beginning to see, then I start seeing dentists. So tooth decay have been I'm 71, so you figure cavity started before I turned 10, I think. So you can say all throughout my life, 30 years ago, I would be every 3 months at the dentist's office doing gum cleaning because I got gum bleeding. Then the dentist tell me after I gave birth to my 2 sons that I lost 40% bone density. So my tooth, my gum receded. Actually, my bones receded or disappeared, my bones, okay? So that dentist said my tooth was just, they were movable back and forth. It would fall, no cavity, but it would fall out. So I managed to don't have any new cavities at all for the past probably 40 years. Ever since I understand I need to change my diet, nutrition, and go improve my health. That's what I told myself. So yeah, my purpose here tonight is that I say I'm an amateur, but just to help everyone to prevent dental decay and gum disease. And 10 years ago, when I saw this ring product, this teeth health never entered in my mind from this product. But after 10 years, during my 10 years, I seen many people have very good results. Okay, anti-inflammation. Okay, problem, especially bleeding caused from inflammation, bacteria, wrong diet, eat too much sweet, or just born with the sugary saliva. That's what the dentist told me. Yeah, I saw from my son. 4 or 5 years old, already got cavities. I don't feed them sugar that much, but they just have cavities. So later on, when I start studying about diabetes, yeah, my mom was a diabetic, my grandpa. So my mom had all kinds of dentures. Okay, I know she used those dentures. So when I'm young, I don't pay attention, but it's just I know it's probably part of aging. But honestly, it's inflammation. Okay. Of course, now the latest thing they discover now, stem cells. If you ever your tooth, you lose a tooth. Very soon they're gonna have stem cell can grow your teeth, grow your tooth. Okay, it's coming. So I part of the down in 62% anti-aging. That's probably should be good. I think these are all the so-called DNA stem cells whatever they're doing research. So growing a tooth with your stem cell. Well, this product, I just go real quick, okay? Black cumin seed, ring soul. And definitely I have people have very good result with if they go have whatever kind of like pulling tooth, whatever things they have to go do, okay? When they come back and take the ring soul, they notice that not so much swelling. This is something because, like I say, anti-inflammation certified. So a lot of people use it when they go see dentists for major work. And also, the science with black cumin seed has a lot of science. I think one of them inhibits secretion of histamines. And a lot of problem that come from the teeth started out as allergies. That's how you see doctor say, oh, we couldn't find anything in your blood. There's nothing growing, just allergy. But this is one thing about black cumin seed. It can do quite a bit because of anti-inflammation property. Okay, so you've seen all these before. Black cumin seed is a powerful seed. Just to mention a few that's related to the oral health, epilepsy, anything related to the brain. Okay, chemical weapons injury, lots of stuff that we put in our mouth, not so great. Okay, antibacterial, you find out there's all kinds of bacteria inside your tooth. Now, the black cumin seed has lots of science and it has complete nutrition. Okay, just want to focus it down here, phytochemicals. I went into internet and also try to catch up with my old book. And the more I was reading, phytochemical is very important. I'm telling you, the whole thing is about chemical processes in your mouth and then your digestion, and very important. And also eating bad fat, bad oil will trigger that too. I'll explain. Now you have to watch the other video. Now, Dr. Wicks wrote this, and when I was sharing Rain Soul in USA, he wrote it very simple. He said, we need to give our body an oil exchange. Just remember oil and fat can be used. I mean, they're different, but it's almost the same here, okay? It just say, when you receive how should I say, when your body gets a grand opportunity to consume perfect oils, like in the black cumin seed or called ring soul, receive the perfect lipids, instantly start replacing the bad and the very fast as good. Okay, very fast. Your body just knows what's good oil, what's bad. Okay, and live deliver right into the cells. Okay, so just kind of, this is what Dr. Wicks summarized it, which is very, very, that's what I've been sharing for the past 10 years. See, our body knows exactly what's good from bad. Okay, and you heard about this before, oxygen. So just remember it, okay? And cellular membrane, because I'm going to mention it later. Essential fatty acid, and it's bringing oxygen, okay? The good essential fatty acid, copress, will allow, it is like oxygen magnet, provides oxygen into every organs, every cells. Sticky blood, and this is the bad fat, bad oil in the blood. Now, just remember, you see the teeth is part of the head. Okay, what's in your mouth, these teeth, they're connected. And I'm not kidding with you, you know, because, you know, I met a lot of people all throughout the years, and all of a sudden this friend pulled the front tooth. Something went wrong with the front tooth. She's only like maybe 50 years old. It was in USA. And she just, the dentist recommended to pull the two tooth out. And she did. And now that I don't remember, you know, this is like 20 some years ago, she died 3 months later through a relative told us. You know, she's a healthy lady. Why? Just got rid of these two tooth and she died 3 months later. Of course, we didn't know what's about. So probably now what I know is probably bacterial infection. Of course, today, anybody go do any so-called extensive mouth work, doctor usually give you antibiotic. Okay? You have to take it for, I don't know how many days, depending on how serious you're doing your teeth or your gum, whatever, or root canal. Okay? Now they start doing it. But 30 years ago, it was not popular. I mean, I remember I never took any antibiotic when I had my cavity filled. I don't remember. But now every single friend go, they want to make sure to know, I guess, no infection. See, your brain needs 25% of the blood to support, and 20% of all your oxygen support the brain. So just remember, okay? The brain very important, okay? It's right. I mean, it's part of you. The mouth is just right here, and anything, I mean, travel. The limbs are up there, the blood vessels are up there. The nerves, okay? The nerve controls the whole body. Okay. So it runs everywhere, okay? Your whole body's connected, okay? Not just in your, don't think lightly about having a cavity. See, I think, like I say, my focus just to want to help you to prevent cavities, okay? And good teeth, okay? And then we'll be good health. So now you heard me talk about the latest report about Parkinson's disease starts in the gut. Is the bacteria from the gut travel to the brain? You see, we have bacteria traveling everywhere. And there was somebody, I wonder it's a Hong Kong University, some report I read or I heard from the TV, it's the amount of bacteria in your mouth, the more bacteria in your mouth than the toilet. Well, that's the comparison. When I heard that, I kind of, are you kidding me? But that's what I said. Now, what problem could poor dental health cause? Now that they, you know, generally aware. I used to have a lot of gum bleeding when I'm brushing. And you know, of course, now they tell you don't use a hard brush. So take care. So go buy some good. I know my son's using a hard one. They think gum bleeding. Quote: the bacteria can travel inside and trigger heart disease. Okay, so stroke. Sure enough, it's right there. I told you, my brother just pulling tooth. She passed away 3 months. So stroke too, near the, the mouth. And cavity, bad health, bad breath, tooth loss. Well, that we know. Gum disease, we know. Oh, diabetes. I told you something different for diabetes families. They don't eat sweet. They take care of themselves, but come on. Why my son 4 years old already got cavities? I was shocked. I was so shocked. 4 years old. Now, mouth cancer. Getting more and more. nowadays. And I told you, I listened to a doctor in a couple of months ago talking about using mouthwash. He said, "You're doing mouthwash, you better stop doing it," he said. And he's a professor, he's a PhD, and doing research on nitric oxide. And he said there are good bacteria in the mouth, in your saliva. And these good bacteria will go in and clean up your blood vessels. If you do mouthwash, you're killing them. And your blood pressure eventually will go up. So this is what, and he tests people. They, data, gathering data. Those people, if they're young, they stop the mouthwash, 2 weeks, the blood pressure back to normal. So poor dental health can cause all kinds of problems. Now, I want to mention mercury. And this is what this book is about. This famous dentist. Like I say, he'd been fighting. He presented his research and to the American Association Board. They refused to listen. They refused to listen because amalgam is 50% silver, 50% mercury. Of course, they have other alloys too, copper, zinc. Every manufacturer do a little different thing, but in general, you can say silver and mercury. Now, we all know today, as an average consumer, mercury is heavy metal. It's one of the worst heavy metal. But how many people I would love to survey, see, are the Asian countries still hang on to amalgam, or they already switch over to porcelains? Okay, of course, porcelain had a lot of other stuff in there too. It's not the best, but of course, the best is to prevent cavity. Mercury, if you have amalgam filling, 50% is mercury. You know what mercury does? Mercury kills cells by interfering with the ability to exchange oxygen. You could be a marathon runner, walker, very sporty, you do exercise every day. I tell you what, years ago, I think this must go back to 25 years ago, I visited one man. I believe he was a Japanese. Yeah, it was a Japanese family. I went to introduce to him herb because he suffered. I visited his home. He was on wheelchair. He was a physical education instructor, teaching, playing balls, games, and all the sports with children. He's active. I remember when I visited him that time, he was only 57 years old. So he shared with me, he suffered Lou Gehrig's. It's worse than Parkinson's. It's like he's a vegetable. He's a vegetable. He's a stiff. Parkinson is shaking. Lou Gehrig is stiff, and he not movable. So it's very interesting. And all I remember, that was the time I started learning about amalgam filling, mercury. So I asked his wife, I said, does he have a lot of cavities? She said, yes. I said, are they amalgam, silver color? That was it. It's that I think probably 90% of the dentists recommend to average people, unless those so-called wealthy people ask for gold. So then I also asked her one more thing. I read this to you. Mercury vapor. You know, you have a mercury filling, and here you're eating something what? Like chewing gum. You're chewing gum, okay? That means, you know how it is. You, you squeeze the teeth, and then it rubs into that silver filling. So guess what? Chewing the gum. One patient, after chewing gum for 2 minutes, only 2 minutes, exhibit a level of 300 mcg over his fillings. They have these tube to test it. Just 2 minutes, 300 mcg. And did you know that in an office building, they have to fulfill all these, sprinkler, fire, all this equipment, and also make sure there's no heavy contamination of mercury in the office. And that regulation allow only 50 microgram, 50. Can you beat that? You chew gum 2 minutes, really, you release 300 mcg. In other words, if I chew gum 2 minutes, then I spit the gum and I go, I blow I'm violently, I cause the room to violate the health ordinance. 50 is the maximum. You know what the law in California? If your office building at 51 mcg, the government can fine the offender $10,000 US and close the facility. Amazing, huh? Here I'm chewing gum. That's exactly what the Japanese guy, I asked the wife. I said, does he chew gum a lot? She said, yeah. He chew gum every day, all these. It just, that's why he suffered Lou Gehrig disease. Because they have done tests since then. They are very good, loving dentists. They do experiments, and they will remove the mercury amalgam filling, and the patient recover. They recover. So mercury kills the cells, interfering with the ability to exchange oxygen, nutrients, and waste products. So that means the cell will be so poison, so toxic. Inside the cell, mercury destroy your DNA. That means your original DNA instruction for cell multiplication stop. Yep, that's how mercury looks like. That's how it's inside your mouth. What is mercury toxicity? When mercury in your cell membrane, the immune system starts destroying your own cell. That's called autoimmune disease. Don't you notice there's so many people suffering autoimmune disease, and there's no way the doctors can help? That's maybe one of the reasons. Next time you see someone like that, ask diabetes, lupus, MS, that's what it is, okay? Mercury can interfere with nerve impulses, transmissions, so causing mental problem. Mercury can become attached to the hormones and deactivate them. So all the hormonal out of balance, thyroid problem, pancreas problem, insulin problem, sex hormones, and guess what? The doctor cannot find it because the blood tests all show normal. Your hormones on the blood test should be normal, but because this is, again, this book is 30 years old. Now now they use the urine test, urine analysis. I've done my hair too. You can go cut your hair and they can analyze it too. Okay, so the blood test will be normal. That's the scary part. Now cavities. Cavities Okay, so doctor would do some drilling. Now, guess it's cavity. What are these little white, yellow, kind of like hair-like stuff? Tell you what, that's called dentin. These are tunnels. These are tunnels. Okay, so you see the cavity filling, amalgam filling. Okay, so but deep down here, okay, dentin. Okay, right next to the dentins, there are tunnels. There are tunnels. If you add the whole thing up, okay, I'll show you the next picture. This pulp is soft. It consists of all the blood vessels and the nerve. The yellow line is the nerve, the red and blue are the blood vessels. The blood carry the nutrition and oxygen all over. Only the outside enamel's hard. Now, yeah, enamels are hard coating. The dentins right here, you see all this wrap around right under the enamel, wrap around. These are all tunnels. Dentin is the middle layer of the tooth. Okay, now the blood vessels carry nutrients to the tooth. Right here, the red. And these are the nerve. Signals the pain from bacteria. Okay, now these are the dentins. Okay, under the enamel right here, you see the little holes here? They're called dentinal tubules. They're actually tunnels. The scientists said the tendons, if you line them up, add up all the tubes, it's about 3 miles long inside for your tooth. One tooth. If you add all the tunnels up, it's about 3 miles long. So when this bacteria start traveling inside, you think when the dentist drill, clean up, and you see dentist put some, I don't know, maybe some gas in there to make sure they get all the bacteria killed. Is it possible? No one knows. Because there's so many tunnels, so many tubes. Some bacteria can hide way deep down here. You understand? You see? Can way down here. And then through X-ray would drill enough. If it's way down here, usually they go say, oh yeah, do a root canal. It's already hitting the root. So just to let you know, the dentins are tubes. Remember, whatever you eat, whatever liquid you drink, whatever you put in your mouth, it's going to go right in, outside, inside, everywhere. Very important to know that, okay? Bacteria can grow in there for a long time, so depending on what section of the, part of the tooth they're hiding. So are you feeding the bacteria? What about the mercury? Who knows? You see, this is it. This pulp is where all the blood vessels feeding or growing, okay? Actually, our tooth can regenerate. There was one time I read one case. The dentist was on vacation. So the mother, the son had cavity. Well, had to wait for the dentist to come back because sometimes, there are not too many dentists you trust. So 1 month, after 1 month, the dentist came back, and the mom took the son to see the doctor. Was a little kid, and during that month, she really fed him good because she doesn't want that cavity to grow too big, right? So I guess she mentioned she was eating a lot of good oil. See, this is the hardest material, calcium, all the minerals. What was good for the enamel? You need oil too, okay? All I remember in the article is that she like butter, she just got a lot of stuff going in to make sure the teeth is strong, the tooth is strong. After 1 month, the dentist come back. Dentist check her out and told the mom, gee, the boy's cavity is not there anymore. So it regenerated 1 month, in 1 month time. So now the latest is they can grow the tooth via stem cell. So this is it, you see? But you need to have good, this is the chamber, pulp chamber, where all the blood, the nutrition, everything here are responsible to grow the dentins, the tooth, and the enamel. Possible if you have a good diet. But if you're always drinking these sweet drinks and always, all you put inside your mouth is all these things that are bad for the teeth. I know people drink 6 cans of Coca-Cola a day. Yeah. And guess what? They visit to the dentist so much. Yeah. So this is it right here. So it tells you right here. The role of tooth pulp aids in sensory function, helps form dentins, grow them, provide tooth moisturization and nourishment. That's where very important is nutrition. Don't think the tooth is kind of like out in nowhere. No. There's a lot of blood here. You need a lot of nutrition, oxygens, and the minerals, everything. Live food. Okay. That's why all I can tell you when I hear all my testimony from friends that now the sensitive teeth gone, after taking Rinso and this is gone, this is gone. This is it. When you're eating whole nutrition foods, your whole body will get benefited. Okay. Now, so this is healthy teeth, healthy gum. This is, you see, these are receded, this is gum disease to the point that they lost the bone and the roots are sticking out. So this is called sensitive teeth. Now, that's what I have. But thank God all my tooth look horrible. It's recede, but still my real teeth, they're strong. They're stronger than 30 years ago. 30 years ago, it was so bad, it was moving. Dentist told me they might drop out. So I had to go into the dental office to get some tape to put it over, cover the root so that I will not get sensitive. But now for 30 years, I just thank God, very good. I took care of myself. You know one thing, before once you, like I said, go use soft toothbrush. Don't use too harsh because you disturb the gum, okay? And it would be good you dental floss it, okay, every night, dental floss it. And and then after you rinse it off, in fact, get a bottle, mix a bottle of water with sea salt. Just mix a bottle next to your in your I guess toilet, or your kitchen, no, bathroom. And then when you finish, just rinse and gargle. Rinse. I think rinse is enough. A little salt water before you go to sleep. Okay, so that is a good way. And I now, because I don't want to rub my gums too much when I wake up, I just use salt water to rinse. That's it. Because after I, slept all night, I didn't eat anything, so I don't see it's dirty. Okay, so that's how I do it. Okay, and so I seen people do that regularly. They do have good result. Of course, after you eat every meal, it would be good to just drink one mouthful of water and just rinse your mouth every time you eat. That would be good. Yeah, there are people very faithful. I see them go to the the restaurant bathroom to brush their teeth every time when they finish eating too. I'm not that I'm not that type yet. So I manage to rinse every time when I eat a special sweet stuff. Okay, just make sure you use water to rinse your mouth, eating every sweet. So you keep that kind of like uh, good environment in your mouth, you get less cavities. You take care of yourself, put it that way. If you take care of your teeth, you should have less cavities. So why I tell you now, so just back to ring sole. Ring sole is antifungal bacterial. There's something in the black cumin seed. So I think it's a good product to take because like I told you, some of these people go to these dental work and they come back and take two sole and they notice swelling is gone. And again, it promotes good nutrition and from whole food. You're getting good calcium, you're getting good cold press omega. I mean, so what more can you get from other stuff? No, this is it. Uh, I mean, recently there's one lady in Hong Kong. She just joined, and so funny. She told her friend because when she take the soul at night, there's a lot of seed, right? She decided to use the seed. She didn't want to swallow the seed, I guess. She just take the seed and put on the toothbrush. She said, "No, I didn't use any toothpaste last night. I just want to use the black cumin seed in the ring sole and brush my teeth." And she said, "Oh, I felt good." So that was I heard her last week. Now again, I tell you, the saliva has lots of good bacteria. I know I heard the doctor talk about 4 kinds of bacteria that's very good prevent. Put it this way: keep your oral bacteria in harmony. Okay, I mean protect your teeth. So our ring pear is very good. There's no sugar added. They use stevia. Okay, and just let you understand, it's estimated 75 trillion to 100 trillion bacteria inside our body, but 80% are in the stomach intestine area. 80%. And then what do they do? This is it. Healthy human beings, 95% of these bacteria are responsible for a number of vital body processes. Remember what I talked earlier about mercury? Mercury is pretty hard to get it out, and they are trapped in the membrane, the fat. Yeah, any type of fat, bad fat, tend to draw the mercury, store the mercury inside the fat membrane. The cellular membrane is 55% cholesterol. But if you have bad cholesterol, and especially people are overweight, those heavy metals get trapped inside. And it, it, it just stops your cellular function. It stops oxygen exchanging. So you can see slowly your cells are not so normal processing things. You see, also when we have good bacteria can do a lot of stuff. It can help you clean up. It help you change these chemicals. So make sure it can eat some fat, the bad fat. So our ring sole is powerful. We have 12 strains of good bacteria. And I know one strain is for the oral, for the mouth. That one particular one, okay? And it just, we have 20 billion. CFU. CFU means these are live bacteria in our intestine. So if we expose to some mercury, you see mercury is in water, I mean, everywhere, the air, lots of stuff that we use, and not just in the mouth, but go check if you have some amalgam feeling and you've been feeling funny all this time, you might consider it. Okay, go check your dentist. But again, some dentists will tell you, no, they say, okay. But I know 30 years ago, I changed mine. So just remember, these good bacteria, if you're good bacteria, at least, you know, mercury, if you do have exposed to mercury, it kind of like cause the cells slow down, and it can even cause DNA damage. By taking rain salt, it's a good oil in, bad oil out. So when this bad oil out, it will speed up the detox of mercury. It can. It sure can. Okay. So this is it. Taking rain salt and taking rain pure. I think what I seen all these throughout the 10 years. I mean, the only reason I see people have such a fantastic story, completely overhaul their health. That's the miracle part. And I think it's the soul and all these, the rain peer doing all this body chemistry in your body, you know, the phytochemicals in the black cumin seed, and also the rain peer, all these bacteria. Given time, your body chemistry is going to improve. More than just nutrition. We have nutrition. Yes, we have that. Every supplement on the market has it too. But ours cold press is omega, essential fatty acid, is creating overhaul your body chemistries. This is the beauty of it. And yes, brain soul, brain peer, take care of all those microbes activities. So honestly, I just say we need to take care of ourselves. Clean outside, clean inside. So simple. The whole thing is chemical. And good oil in, bad oil out. Good oil, anti-inflammation, good oil, good hormones. And I have to say, you know, this little boy in Vietnam, he's been on the product for probably 5 years now. He was super overactive, diagnosed by the brain doctor. Yes, so simple. Take rain so 2 packets a day. He has lots of A's now, and he's still taking it. I think his father can sell at least 200 boxes a month in Ho Chi Minh. He loves the product. He's his only son. I remember when he first came to my meeting, he just say, well, maybe I got married old when I'm older, and then my son is overactive. I said, well, try it. But I think it could be, who knows, bacteria. Or maybe mercury contamination. We don't know. All I know, rain salt can do a lot of chemical processes in the body. They didn't have rain pure yet. So this lady, remember, I told you it's bacteria, but who knows? It could be mercury too. She told 8 packet of rain salt. You see, now all I can tell you is just anything can happen. Bacteria. Doctor told bacteria. So take rain salt, kill the bacteria, and take rain pure. Bring everything back alive. Improves the chemical processes in your body. So I think, you know, the more I'm learning from all these story, I just say, come on, I'm not going to talk about antioxidant. I'm not about nutrition. Hey, come on, this is a food. You're going to increase your body chemicals, processes. Okay, get rid of your heavy metals. Oh, the core. I almost forgot. The core. The Budapest doctor that is giving health talks in Europe, I think every Tuesday or every month. She said core, she said it definitely detox mercury, metals, because greens. I heard about greens long time already about detoxing mercury, but she purposely say rain core is the best. She loves saying rain core. So take salt, take core, and pear. I think if you do once, even just once a day on this 3 product, you have no worry about metal toxins, okay? Because it will clean it up by itself. So she took it for 6 weeks, all clear, back to normal. I think this lady too, she got dengue fever and her brain got crazy for a whole year. Husband thought she got evil spirits. Spent a lot of money chasing the evil spirits. But after taking 1 core, that's it. She was the lady came to my meeting and got a free little core that night for sample. She took that 1 core and that's it. She woke up the next morning, told her husband she went to the toilet 12 times. Just one night. And the doctor said, and the husband said, oh, you should have wake me up. I mean, I would have, you need to go to hospital, because you can die from dehydration. She said, no, I feel good. She said, I saw all kinds of ugly stuff came out. And then woke up in the morning, she felt healthy. So it could be, it is bacteria. And also, when you have bad bacteria combined with the mercury, it can do a whole lot of damage in you. And doctor can never diagnose it. So core, I'm glad I remember. Core is the heavy metal eliminator, terminator of bacteria too. Okay, so please just understand ours is a food product. So if you have anything trying to regenerate and detox, take time, okay? Take time. It does take time. Brain, liver, stomach, blood, okay, bones, but sure this product works. Okay, so that's it. I hope everyone learned a little bit about how to, how should I say it? It's calling awareness, okay? Just so that you know what you put in your mouth, soaking your precious teeth, that you want to keep your teeth for your lifetime, okay? Just think, when you think about that, next time when you go out, I mean, you can enjoy drink a little sweet stuff, but just make sure you rinse it with a mouthful of water, plain water. Okay, and then rinse at night with some sea salt water. It's good. Yeah, because that's alkaline. Your saliva is alkaline. But you eat a lot of sweet, or people from diabetes family, their saliva tend to be sweet. So it's acidic. So that's why, I mean, that only way I can explain when my son at 4 years old was having cavity. That's even the baby tooth. I took him to my classmate. He's a dentist. He said, wow, so young. I said, we try to stay healthy, brush everything, water, pay, how we get the whole thing. But no, it's what you put inside your mouth every time. So if you do a little thing like that, and I think you will keep your teeth. At least I'm keeping mine. I haven't seen a dentist for 70. No, I haven't seen a dentist for 30 years now. I got a lot of tea stain, coffee stain, but it's okay. Just make sure outside's white is enough. That's my priority right now. Okay, so I hope someone here tonight learned a little bit more